Now that you've learned how to build your treatment effect estimator, in this lesson you will learn about methods for evaluating your estimator. The challenge with evaluation is that we cannot see what happens to a patient under both the treatment and control conditions, and you will learn how we can tackle that. We have seen how we can get an ITE estimate of negative 0.33 for this patient. How do we evaluate this ITE for this patient and for other patients? We can, of course, give the patient the treatment and get the outcome for the patient under treatment. That's Y1. For this patient, we find that they did not have an adverse outcome. To know the real effect of the treatment, we'd have to know the counterfactual, which is what would have happened to them without the treatment. Now, we don't know the counterfactual outcome Y0 for this patient, but perhaps we can find another patient just like them in the control arm who did not get treatment and use their outcome instead. There are two ways that we use to match this patient with another. The first way is to find a patient that has similar features that is in the control arm. Here, this patient is very similar both in terms of age and in terms of blood pressure values. The second way is to find a patient who has a very similar estimate of treatment. Here, the patient is a little less similar in terms of age and blood pressure, but is more similar in terms of the estimate of the treatment effect. For both methods, the matched patients have an outcome under control of 1. Both methods here are appropriate for the evaluation procedure we're running through, so we will stick to one, the second one, for clarity. We now have a pair of patients, one in the treatment arm and another in the control arm, that we have matched to each other. We can now take the average of these individual treatment estimates to get a prediction for the matched pairs. We can also get the factual outcomes from each of the patients and use that as the factual outcomes of the matched pair. Using this, we can now compute y1 minus y0, which comes out to negative 1, which means that we observed benefit for this matched pair. We can repeat this matching for other patients and get the observed difference in outcomes for each of the pairs. For the first pair, we observe that this difference is 1, which means that we observed harm. For this third pair of patients, we have a difference of 0, which is observed no effect. This is now cool because now we can determine how well the individual treatment effect estimates for each of these pairs of patients reflects the observed difference in the outcomes. In other words, does higher predicted benefit actually correspond to observed benefit?